To better understand gastritis, it's important to know what happens in the normal digestive process. As you chew your food and swallow, food particles travel from your mouth to the esophagus. The esophagus is a muscular tube, can contract and relaxes in a wave-like motion to help move food and liquids down toward your stomach. This is called peristalsis. Just before the esophagus gets to the stomach, it travels through an opening in your diaphragm, called the hiatus. The diaphragm is a broad muscle that separates your stomach from your chest cavity. The esophagus then joins the stomach at the lower esophageal sphincter. This sphincter acts as a doorway between the esophagus and stomach. After you swallow, it opens to let food into the stomach. Then the sphincter closes to keep food in stomach juices from going back up into the esophagus. The hiatus also helps close up the entryway to the stomach. Inside your stomach, strong acids and enzymes make up the stomach juices, break down your food. Your stomach has special mechanisms that help protect itself from the strong juices. But your esophagus doesn't have the same defense. So it's important to close up the stomach opening to keep the juices in the stomach. Sometimes the acidic contents of the stomach could go back up or reflux into the esophagus. Occasionally, reflux is normal, and much of the time, it never causes any problems, because the esophagus also has some ways to protect itself. For example, the saliva in your esophagus can help neutralize stomach acid, and gravity in peristalsis help to wash the saliva and stomach juices back down into the stomach. But other times reflux can cause the burning pressure or pain in your chest or throat.
Gastritis is an inflammation, irritation, or erosion of the lining of the stomach. It can occur suddenly, acute, or gradually, chronic. Gastritis can be caused by irritation due to excessive alcohol use, chronic vomiting, stress, or the use of certain medications such as aspirin or other anti-inflammatory drugs. It may also be caused by any of the following: Helicobacter pylori, H. pylori, a bacteria that lives in the mucous lining of the stomach. Without treatment, the infection can lead to ulcers, and in some people, stomach cancer. Pernicious anemia, a form of anemia that occurs when the stomach lacks a naturally occurring substance needed to properly absorb and digest vitamin B12. Bile reflux, a backflow of bile into the stomach from the bile tract that connects to the liver and gallbladder. Infections caused by bacteria and viruses. Symptoms of gastritis vary among individuals, and in many people there are no symptoms. However, the most common symptoms include nausea or recurrent upset stomach, abdominal bloating, abdominal pain, vomiting, indigestion, burning or gnawing feeling in the stomach between meals or at night, hiccups, loss of appetite. Nausea or recurrent upset stomach, abdominal bloating, abdominal pain, vomiting, indigestion, burning or gnawing feeling in the stomach between meals or at night, hiccups, loss of appetite, vomiting blood or coffee ground-like material, black, tarry stools. To diagnose gastritis, your doctor will review your personal and family medical history, perform a thorough physical evaluation, and may recommend any of the following tests.
Upper endoscopy. An endoscope, a thin tube containing a tiny camera, is inserted through your mouth and down into your stomach to look at the stomach lining. The doctor will check for inflammation and may perform a biopsy, a procedure in which a tiny sample of tissue is removed and then sent to a laboratory for analysis. Blood tests. The doctor may perform various blood tests, such as checking your red blood cell count to determine whether you have anemia, which means that you do not have enough red blood cells. He or she can also screen for H. pylori infection and pernicious anemia with blood tests. Fecal occult blood test, stool test. This test checks for the presence of blood in your stool, a possible sign of gastritis. Treatment for gastritis usually involves taking antacids and other drugs, such as proton pump inhibitors or H2 blockers, to reduce stomach acid. Avoiding hot and spicy foods. For gastritis caused by H. pylori infection, your doctor will prescribe a regimen of several antibiotics plus an acid-blocking drug, used for heartburn. If the gastritis is caused by pernicious anemia, B12 vitamin shots will be given. Eliminating irritating foods from your diet such as lactose from dairy or gluten from wheat. What is the prognosis for gastritis? Most people with gastritis improve quickly once treatment has begun.